care unit equipments. So before getting into the equipments, we can able to elaborate what is intensive care unit is. So when it comes to the multi-specialty hospitals, they have lot of departments, starting from the emergency care unit, then cardiology department, ophthalmology department, nephrology department. There are lot of departments out there in the every multi-specialty hospitals. But why every healthcare providers and every persons are saying ICU, that is called intensive care unit. So they have some kind of protocols to follow strictly. So what are the protocols they are following and why they are calling it as an intensive care unit? So for example, if a person is having any problem related to their heart, they can able to go for the like cardiology department, and if the person is having any problem in their related to their eyes, they can able to go for the ophthalmology department. So the first procedure of every department is to diagnose the problem. So the diagnostic procedure will be taking care of the healthcare providers and the nurse, and every healthcare providers will be taking care of that. So after taking diagnostic procedures, then they can able to give for the treatment. So what kind of treatment they can able to give? So the person who is having a treatment regarding or related to their height, they can able to follow some kind of protocol, the procedures. Then after that, if they can able to give some kind of medicines, they can able to recommend the medications for that particular problem. Then if it is not taking care, like it is not solved on that time, they can able to give some kind of duration for to cure the problem. Then only they can able to go for the surgical procedures. Okay, so they can able to say like drug relief system is okay. What is drug relief system? Why I am just including the drug relief system in this part? Because the equipment used in intensive care unit, they are using lot and lot of equipments. They can able to monitor the patient body, they can able to monitor the patient vital signs, they can able to diagnose the problem with the lot and lot of equipments, and as well as they can able to give a treatment to the patient body with a lot and lot of technologies by using the principles, and they are following lot of protocols. Okay, so why they are taking care much? Every patients can able to be in the ICU units. So why? So for example, if a patient met with an accident, okay, he's a major accident, he have met with the major accident. So initially, when it comes to the healthcare providers like the physician, they can able to take to the ambulance and to the hospital. They will be going to the emergency part. So during that time, what they will do, they will be checking the heart rate, then the pulse rate, then they can able to clear all the blood, okay, with the help of the equipments. Like for example, suction pump. Then how I can able to treat the patient with the help of drug delivery systems. With the help of infusion pump and the syringe pump, they can able to administrate the drug into the patient body. Right. So as well as we need to note down like whether my drug is accepted by the patient body or not. For that, they need to monitor the vital signs of the patient body. Okay, so every equipments, which is very high costliest one, and they will be following some kind of standards. So what is the standards? They can able to go for routine checkup of the each and every equipment which has been presented in the intensive care units. Even though they can able to check some kind of equipments in the casualty units like by weekly ones or monthly ones like that. But when it comes to the ICU, that is intensive care unit, they need to check each and every day whether it is working properly or not. That much protocol and that much rules and regulations should be followed in the intensive care unit. In that part, every healthcare provider they will be monitoring the patient 24/7. I think some people you may all experience sometime, like if your relative or if your brother or sister, if they are admitted in the intensive care unit, they will be allowed some kind of time to see their patient, right? So why they are doing like that? Because the patient should not get any kind of infection from other environments. So who is just going inside and outside? We, the attenders and the physical care, like healthcare providers. Some healthcare providers like nurse, biomedical engineers, the doctors, they will be on the intensive care unit itself. So that's why they will be making some kind of time allotment to see the patient. There is also not much time. Only 15 to 30 minutes they can able to allot the time for each and every individuals. Okay, so that much more care we need to take care of the patient body. So as well as we need to take out the equipments also. So in that part, what are all the equipments we can able to see? So for example, so for monitoring the patient vital signs, we can able to go for like when it comes to the casualty of the clinics, like sphygmomanometer, then pulse oximeter, then we can able to go for the stethoscope, then we can able to go for like what, and ECG. So these are all these some kind of equipment and instruments they can able to detect some kind of problem from the patient body. So we are going to integrate the all vital signs and we are going to monitor in the single system, that is called patient monitoring system. Now I will be showing the image. So this is called the patient monitoring system, or we can able to say it is a vital paramonitor. So why they are using this? So in this patient monitoring system, they will be having initially a common 5 vital signs we can able to measure. So first thing is the temperature. We can able to measure the temperature. Then we can able to go with like ECG recordings. Then we can able to go with the respiration rate. Then the pulse oximeter like the SpO2. Okay. Then what? NIBP. Okay. So nearly 47 vital signs we can able to measure in the human body. In that, only 5 things are very very common. Okay. So temperature, as I said, like BP. Okay. So when it comes to BP, that is blood pressure, we can able to take it into 2 types. One is NIBP and another one is the IBP. Non-invasive blood pressure is called the NIBP, and when it comes to IBP is like invasive blood pressure. So what is NIBP, like NI and I? NI is non-invasive, okay. So we can able to ensure that we are not going to puncture their skin and it is a painless procedure. Okay, not invasive is a thing, equipment or an instrument, it is not going to harm the patient body. But I can able to give a treatment or I can able to diagnose something from the patient body. Okay, but when it comes to the invasive, we can able to diagnose through the invasive method and we can able to take some kind of like give a treatment to the patient body through the invasive method. So it is a painful procedure and we need to cure the patient's skin and we can able to see the blood. Okay, so this is called the invasive procedures. Okay, so here in this patient monitoring system, in the display, okay, they can able to in elderly, they can able to use like LCD displays. Okay, but nowadays everyone will get upgraded. So what is the latest technology and what type of things they have upgraded in this patient monitoring system? So in traditional method, most of them they can able to give like they will be integrating 5 equipment to measure the patient's vital signs. But when it comes to the multi-param monitor, they can able to integrate everything. Okay, so here mostly why they are using this patient monitoring system is to monitor continuously. We are going to monitor the patient in the continuous manner. So if you are going to a clinic or if you are going to the hospital for a regular checkup, they can able to check like they can able to take a pulse oximeter. So only how much time the pulse oximeter is spending a time with you. Within 2 to 3 minutes they can able to get the data and they can able to remove the pulse oximeter from your index finger. Right? But this patient monitoring system is not like that. Continuously, okay, it is going to measure your body's vital signs continuous manner. So when it comes to ECG, we all know like 12-lead system, 5-lead system, 3-lead systems are they are using. What about 12-lead systems? When it comes to the 12-lead systems, they will be using 10 electrodes and we can able to take like 12 output signals, right? But we can't able to take like much signals by using the patient monitoring system, because just imagine when the patient is gone with the surgery, okay, he is already having some kind of issues like he may have some kind of pain. So what happens when every electrode has been connected to this chest region, the patient will be feel uncomfortable. So due to that, they can able to reduce the electrodes and they can able to take the what signal they want. So that's why in the patient monitoring system, they can able to use either 5 electrodes or the 3 electrodes to get the minimal amount of signal in the ECG part. And when it comes to temperature, so usually we will be using the thermometers, right? Thermometers are mercury thermometer, digital thermometer, and the infrared thermometer. So in this patient monitoring system, they will be using the thermistors or the thermocouple. So they can able to insert. They will be having the T1 and T2 part. What is T1 and T2? They will be calling it as the temperature 1 and the temperature 2. Pulse oximeter will be having the single port. ECG will be having the single port. NIPP will be having the single port. But when it comes to the temperature, they will be having the dual port. Why this is? Just to measure the internal temperature of the human body as well as the external temperature of the human body. The both thing is very must. For example, if you are during the surgical process, okay, during the surgical procedures, I am using the patient monitoring system, so I can able to ensure like every vital signs is in the normal manner. When the patient is taking some kind of anesthesia, if the anesthetic agent was very higher manner, if I am giving a very higher manner means the patient body temperature will be get reduced. So to ensure that what is the like they need to keep the vital signs in very constant manner. So after completing the surgery, when it comes to the ICUs, these are the things they will be measuring. Okay, whether the drug is working properly or not, whether I am taking care of the patient in a very well manner or not. So everything should be taken. And one of the things is like when it comes to the patient monitoring system, the cost. Okay, so what are the brands? So Mindray, then Contact. So these are all the very familiar brands regarding the patient monitoring system. When it comes to the cost, minimum if you want to buy a quality patient monitoring system, it will be start from 80,000 rupees. So, for example, like okay, I can able to get the 50,000 rupees of patient monitoring system, but you can't have some other specifications related to that. Okay, so if you want to buy a quality product, it will be cost around more than 80,000 rupees. And as a biomedical engineer, what is the first step you need to take in the ICUs? That calibration. So when it comes to the calibration process, when we are connecting any equipment or any devices to the patient, before that itself you need to ensure whether the equipment is giving the proper reading or not, whether the equipment is harming any persons or not. Everything should be, you need to take care of it. So, if I am touching the equipment, okay, it has been made up with the metal or steel, and the equipment, it is giving some kind of shock. So definitely we need to take care of that. Okay, I need to solve this problem on the spot itself. So every hospital management and every biomedical engineers, they need to follow the standards. Okay, how much the leakage current should be in the equipment? What is the input voltage? Whether the output is giving properly or not. By using the electrical safety analyzers, we can able to take care of this equipment. And then by using the stimulators. When it comes to the stimulators, it will be making some kind of artificial. For example, I am having the human body, because when it comes to the calibration, whether it is working properly or not, I should not connect this patient monitoring system to any kind of patient's body. We should not give like takes any kind of experiment regarding that. So for that purpose, they will be using these stimulators. Okay, so these are the we need to take in the intensive care unit, because in some multi-specialty hospitals, they are taking or recruiting the biomedical engineers especially for the intensive care units. And what are the role? You can able to go for the calibration. You can able to check whether the electrical safety analysis, by using this electrical safety analysis, what is the leakage current, whether it is giving any shock or not. These are the things you can able to get ensure about that. Then cleanliness. So the cleanliness is very important in the intensive care units. Why? Because no patient should be get infected because of that. For example, if a patient is having any kind of kidney failures, what they can able to do? They can able to go for the dialysis procedure. But when it comes to the age like 23 or 24, they can able to go for the kidney transplantations. So after transplanting the kidney, the patient should be in the intensive care unit because they need to be in the cleanliness environment. They need to be in the clean environment. They should not get absorbed in the casualties, because in some casualties the patient will be getting inside and they can able to go out. So the movement will be in the continuously, the movement will be there. But the intensive care units is not like that. They will be make it clean every time. Okay. So this is the patient monitoring system. I have given very outer details about the patient monitoring system. So here in this display we can able to get data like in the numerical format and as well as the graphical representations. So according to our comfortness, we can able what the data I need, I can able to change the display units, or I can able to change the protocols in the patient monitoring itself. Next, what is this equipment? This is called the infusion pump. So as I just during the introduction, I have given you like what is drug delivery system is. So the drug delivery system is nothing but in what way you are just inserting or administrating the drug into the patient body. So in that, when it comes to like oral drug delivery system, for example like a tablet, or we are taking the tonic, they are we calling it as oral drug delivery system. When it comes to the transdermal drug delivery system, we can able to get like transdermal patches. So in the dermal part, we can able to administrate the drug in the skin regions. And when it comes to nasal drug delivery system, nebulizers, inhalers, so these are all the systems. Okay, in what way I can able to administrate the drug into the patient body. So this infusion pump is also the critical care equipment. So this is nothing but like you may have an experience like some patient will be having like a dehydrator, and during that time they can't able to take a proper food. So at that time they can able to take a glucose or saline waters in their body. So what kind of methods they can able to use? So they will be using the gravitational method. So in the IV board there will be a glucose bottle will be hanging, and they will be having the IV lines, and the patient body, in this patient when they will be inserting the IV cannulas. After connecting the tubings, they can able to administrate that particular drug into the patient body in the controlled manner. Okay, so there will be a roller clamp will be there, so they can able to adjust the speed, in what speed, or it should be going in the droplet format or in the continuous format. They can able to adjust in the particular part. And what is the biggest disadvantage in the gravitational infusion therapy is, IV therapy is, if the bottle, the solution in the bottle, if it get drains, the blood from the patient body will be going in the upward direction, because it will be creating some kind of negative pressure. So due to that, the blood will be travels directly into the bottle. So this will make a patient more uncomfortable. It will make pain, and our blood will be get lost. Okay, so to avoid that, we can able to get into the equipment called the infusion pump. So what kind of drugs I can able to use in this? So normally very low dose drugs we can able to use in this infusion pump, and the volume will be in the larger manner, like 250 ml, 500 ml, 1000 ml, 1200 ml. This much of volume of drugs we can able to use in this infusion pump. So they will be having lot of options in this. So what are all the options they have? Because you can't able to study about the equipment in the outer itself, you can't able to operate that. That's not good. you need to see the options and what are the controls they have inside it. So, for example, I can able to say like VTBI is a option is there. So it's like a volume to be infused. So what are the things they can able to give? So first thing they will be ensured about the total volume. Okay, what is the total volume? For example, I can able to take like 1200 ml and rate. So how much hour I need to give this drug into the patient body. So if I am getting like 1200 ml means I'm just I need to give for like 6 hours. So we need to divide 1200 by divided by 6. So for 1 hour, how much ml I can able to give? I can able to give 200 ml of drug into the patient body. So this is the calculation. I am just saying the only one option in the infusion pump. Okay. So after calculating like this, we can able to give the drug into the patient body. And not only this, it can able to give in the controlled manner like in the droplet manner, and it can able to give the drug in the continuous manner also, continuous flow. Then it will be having some kind of security systems. What do we mean by security systems? So when it comes to security system, we should not get any kind of problem, right? So we need to avoid some kind of problem. So due to that, we can able to include some kind of security systems in that part. So if the bubbles has been detected, so if the bubble has been produced in the IV line means definitely these kind of bubbles can able to enter into the vein region. So it is very dangerous one because it will be making a blood clot in the vein formation. So sometimes you may get the heart attack due to that also. So these are the things we need to make it avoided. So for that they will be having some kind of specified sensors to detect the air trap, air bubbles. Then it will be having the occlusion sensors. What do we mean by occlusion sensors? So when my IV tubing, it is a flexible one. When it gets blocked by with a like what, we may have some kind of blockages in the vein region, and we may having some kind of clot in the vein region, or for example, if the tube may get nicked. Okay, so due to that, the flow will be not in the proper manner. So at that time, it can able to give an alert to the patient or the users. Okay, so this procedure has been get stopped. The occlusion alarm will be indicated in that time. So after that, we need to go, or the healthcare providers, they need to go with that. What is the problem? Okay, so the tubing has been in the needle. Okay, so I can able to take that in the normal manner. So they can able to think or like take what are steps they need to take to reduce the problem. Then, as a biomedical engineer, what is the step you need to take? There will be no errors in the IV bottle, IV tube. There is no error will be in the patient body also, but it is giving the occlusion errors. During that time, you need to take a role of that. As a biomedical engineer, you need to check why this occlusion alarm is indicating what. So, for example, definitely in some equipments it will be not intimate like occlusion error like that. It will be indicated in the error code formations. So, for example, ES601. So E means it will be denoting the electrical. Okay, so I am having some kind of issues in the electrical systems, and what is this indicating 601 means? You need to refer the service manual of that particular equipment. Then after that, you can able to enter, okay, so this is the error. So for this problem only, I need to give a solution for this particular scenarios. So you can able to go through the case studies. So when it comes to the infusion pump, we need to take care in very greater manner. Okay, so this is a very important equipment in the critical care unit because every patient will be taking the drugs. Okay, so they will be having like painkiller medicines. They can able to take like some kind of steroids also in the controlled manner. So that's why this infusion pump is very important in the ICUs. Next, syringe pump. The infusion pump and syringe pump is comparatively doing the same operations, but there are some kind of difference will be there. What kind of differences are there? So when it comes to the syringe pump, the dosage will be in the higher manner and the volume will be in the lower manner. So here we can able to use like within 60 ml of volume we can able to use the drug, and like heparin. So these kind of drug we can able to use in this part through this syringe. So you can able to see there is a display and they have the control units, and we can able to set some kind of protocols in that. Okay, in what manner I need to deliver the drug. It will be deliver the drug in the not in the controlled manner. It will be deliver the drug in a precise manner. So that much accuracy it can able to give compared to the infusion pump, because they are using the high dosage of medicines. They can able to give a low dosage also, but the thing is it need to deliver the drug in the very precise manner. Okay, so for example, if I am giving like 10 ml of syringe, I am fixing the 10 ml of syringe in this part. So for 10 hours I need to deliver this medicine to the patient body, means it can able to do. So for 1 hour only 1 ml will be delivered to the patient body. So it is not only depends upon the dosage or the medicines, it is depends upon the patient condition in the intensive care units. So here also we need to calibrate the equipment whether it is working properly or not, and we need to check whether every operations is doing proper or not, and we can able to go for the settings. So the main thing is we need to give some kind of pre-programmed data, like what type of syringe I am going to use, what is the brand I am going to use, and what is the volume of syringe. We need to give these kind of data in that part. In some equipments automatically it can able to detect that. Okay, in traditional one we need to give the data. In nowadays in this part during this time the upgraded technologies, automatically the syringe pump can able to detect what is the ml range and what is the volume of that and what is the brand they are using in this one. So these are the things is very important in the intensive care unit, this syringe pump. Now next, defibrillator. So when it comes to the cardiology department, everyone we can able to say like defibrillator is there, ECG is there, then stethoscope. Even stethoscope is an instrument they will be using the cardiology department. Yeah, every departments they will be using this stethoscope, not only in the cardiology department, right? So they need to have some kind of vital sign which is common one. Temperature, as I said first, like temperature, heart rate, pulse rate, everything is a very common one for every department. So like that, defibrillator is one of the important equipment in the intensive care units. So how I can able to give an example is like we can able to go for case studies. Okay, so when it comes to the case studies, like if the patient is having some kind of problem related to his heart. Okay, so sometimes after the bypass surgery, he or she may have some kind of problem like fibrillations, or suddenly they may get some kind of cardiac arrest, like that kind of problems. So during that time, what is the initial step the healthcare providers they will be doing is they can able to go for the CPR therapy. So CPR is like you all know, like it's a chest compressions, and they can able to give the gases, okay, air to the patient body. So if it is not applicable and if the CPR is not working at that time, next step is they can able to go for the defibrillator. So here they will be having the two paddles like a sternum and apex. So defibrillator is one of the important thing, because when it comes to the patient monitoring system, infusion pump, syringe pump, or any other equipments, you can able to calibrate with the help of patients also, but that is not an ethical one. That is totally wrong. But you should not check this defibrillator whether it is working or not with the patient body. It is not possible and it is not applicable to, because in some defibrillator it will be recording the ECGs also. So automatically it will be giving indications to you like, okay, give a shock to the patient body, like AEDs, okay, automated external defibrillators. So like that, this equipment will be calibrated by them itself. Okay, so we can able to take the paddle in the compartment, and we can able to select the joules. What is the range? Like 150 joules I am selecting. I can able to give a charge. So when I am giving the charge button, the energy will be stored in the capacitors, which has been presented inside the defibrillator. And after that, it will be giving okay, it has been charged, like that kind of indications. Then after that, you can able to give a shock in that part itself. So after some time, it will be giving the thermal graph paper as an output. Okay, 150 joules has been delivered properly. So this is the way of calibration process you need to take in the hospitals. So we used to have some kind of experience while going for internships or as I work as a biomedical engineer in the hospitals. We used to use this kind of methods every day. Sometimes the graph paper will be not come outside, so we need to go for like whether the paper has been located inside or not. Sometimes the paper may be get completed, so we need to replace the graph paper in the new roll in it. So this is the initial thing we can able to take care of the defibrillator also. Okay, so this is the proper calibration process we need to take in the defibrillator in the ICUs. Then dialysis machine. So when it comes to the dialysis, we can able to say like what is the process of this dialysis machine is like it is doing the process of the kidney, but not exactly like kidney. Okay, why means the kidney is doing lot of functions. Okay, it is taking care of like it is doing 7 kind of process inside our body. It is maintaining the BP. It is doing like electrolyte filtrations. Then these more and more functions are made by the kidney in our body. But when it comes to the dialysis machine, it is doing only one process. It is just removing the toxins from your blood. So here, when it comes to the tubings, it should be sterilized, or we can able to go for the new tubing lines for the patient. Then dialyzers. Okay, so when it comes to the dialyzers, it is a part, and we will be having the very micro level materials will be there, and the process of that material is just to attract. It will be just absorb the unwanted impurities from your blood, and in the opposite direction they will be giving the dialysate. Okay, so when it comes to the dialysis machine, they need to do some kind of regular calibration, as well as they need to give all the rinse options in it. Okay, so prime is an option in this dialysis machine, like they need to do it daily, like regularly. So with the hot water they can able to rinse the tubings, and there is a heart of dialysis there, that is called the motor, which is doing the multiple operation in that part. Okay, so this dialysis machine is also one of the intensive care unit, the patient who is suffer from the kidney problem. Then, so as you all know, the ventilator. So the ventilator. So most of them have asked questions to me like, sir, just we are giving the patient is needed oxygen. Why we can't able to give the oxygen concentrator to the patient instead of ventilator? No, oxygen concentrator is totally different. Ventilator is totally different. So when it comes to the oxygen concentrator, in the very lower flow rate, like for example 5 liters per minute or 10 liters per minute, it can able to deliver the oxygen to the patient body. But the ventilator is not like that. It is just controlling your inhalation as well as the exhalation part. And this ventilator will be having the modes also: CPAP mode, BPAP mode, SIMV mode. So there are a lot of modes has been presented in this ventilator. So in that I can able to give some kind of example for 2 modes. When it comes to the CPAP mode, that is the continuous positive airway pressure. Okay. So if the patient is having some kind of trouble inside their lungs, in the airways, okay, maybe the airways may be get inflamed, or the mucus production will be higher in that part. So we need to expand the airways through the air. So what kind of air? It should be in the pressurized manner. Okay, the pressurized air will be sent inside the airways in their pathways. Okay, so for that, when it comes to the CPAP mode, it will be giving the pressurized air during the inhalation process, and the pressure will be not get varied during the exhalation also. The constant pressure will be maintained in the CPAP machine. When it comes to the BPAP machine, like BPAP mode, because the CPAP and BPAP we have separate machines also. Okay, there are modes in this ventilator. When it comes to the BPAP, the pressure will be maintained constant during the inhalation, and during the exhalation process the pressure will be automatically get reduced. Okay, so these are the things they can able to take care of the B part more in the ventilator part. Okay, and in this ventilator display, it will be showing the graphical representation of your inhalation as well as the exhalation part. Everything will be noted. And whatever the process has been done in the patient monitoring system, the same thing we can able to see in this ventilator machine displays also. Then, this is also one of the important things in the intensive care units, the patient bed. So when it comes to the patient bed, the patient should be feel in the very comfortable manner, and they need some kind of facilities in that. What kind of facilities? So none of the shock should be accumulate the patient body. Okay, so for that they will be using the specified materials in that part, and they will be having the rollers just for an emergency situation to just moving from one department to the another department. For example, if the patient is having very critical situation, he need to do the some kind of surgery, emergency surgery in that part. So during the time they can able to take that bed along with the patient body, and then they will be having some kind of facilities just to increase the height and to decrease the height of the patient bed, and they will be using the sponges. Okay, so the comfortable one, and they will be replacing the material like the outer covers, everything they will be maintained in that part. Okay, you can able to move forward, backward, every assembly we can able to take care in this patient bed. What are the things they can able to use in the ICU units? Then at last we can see about the suction pump. So when it comes to the hospitals, we have lot of equipments, but this is the one equipment will be giving the continuous trouble to the healthcare providers as well as for the biomedical engineers. Why means some equipments they will be having some kind of sensors to indicate the error in that part. Some equipment they will be having automatically shut down when the error has been applied in that particular situation. But this suction pump will be having the very less technology. It will be not having any kind of sensors in that part, and it will be not having any kind of displays. Just we can able to regulate the pressure. It will be having the regulators, and it will be having the containers, tubings, and some kind of bacteria filters, then the catheters in that part. Totally, it will be runs under the mechanical conditions. Okay, so they will be using some kind of motor. Okay, they will be using the compressor motor inside the this suction pump. So with the help of negative pressure, the blood, okay, leakage of blood and the mucus will be just or saliva we can able to store in the particular container by using the catheters and the negative pressures. Okay, so these kind of storage is very important, and if any kind of blockages has been appeared in that tubing or in the nozzle also, the machine will be not get burst. Again, you need to go for the service. Okay, if any students or the researcher, if you want to do any kind of researches regarding the medical equipment, just go with the suction pump, because every hospital needs the good quality suction pump. I'm not saying like this is a very bad thing, but it is making some minor troubles to the healthcare providers. Okay, so these are the very important equipments they are used in this intensive care units. Okay, so just we can able to recall that. So I have just given an introduction about the intensive care units. So what is the role of biomedical engineer in the ICUs, and what are the healthcare providers are taking care of the ICUs? What are the things they are ensuring that part, and what are the equipments they are using in this intensive care unit, and how you need to maintain the equipments. So that is very important thing in the intensive care unit. So thank you very much for this thing. Thank you all.